good afternoon, good morning, good evening, everybody. My name is Hussein Jaffrey. I am the founding director as well as the CEO of the World Patient Alliance. And it's my great pleasure to welcome you all to this important webinar, The Promise of Personalized Medicine, organized by the World Patient Alliance in collaboration with From Testing to Targeted Treatments, FT3. Next slide, please. So this webinar is going to be transmitted into through AI simultaneous translation in over 60 languages. The link will be in the chat box. So you just need to click on that link and you will, in this window on the left hand side will open. You just have to select the language in which you want to listen the webinar, put your name and just, click attend. Another window will open and just click on this speaker and you will listen to any language you want, Arabic, French, Spanish, any language, Hindi you want to listen this webinar in. Next, please. So personalized medicine represents a paradigm shift in healthcare, one that moves us away from one size fits all approach to the one that is tailored to the unique genetic, environmental, and lifestyle factors of each individuals. And this approach has the potential to revolutionize patient care, ensuring that the right treatment is delivered to the right person at the right time. And today we are gathered with a distinguished panel of experts, patient advocates, and healthcare professionals to discuss this incredible opportunity that personalized medicine presents, and the barriers that exist, and the role of patient organizations in advocating for equitable resources. So the aim and objective of this webinar is to share knowledge about the fundamentals of personalized medicine and its potential to improve patient outcomes, empower advocacy efforts by highlighting the crucial role of patient organizations in expanding access to personalized medicine, and also to inspire action by providing practical tools and case examples to influence healthcare policies and clinical practices. I encourage you all to actively engage in today's discussions, ask questions, and explore how we can collectively work together towards a future where every patient has access to personalized care that they deserve. So thank you very much again for joining, and let's begin this very important conversation. Next, please. So we have a very distinguished line of speakers and panelists for today. So let them, introduce themselves. So I'll ask each of one of the speakers to introduce themselves very briefly. So I'll first ask Bahija GOUIMI from Morocco. She is a patient advocate.
Thank you, Hussein. Hello, everyone. Thank you for having me. I'm really honored to be a speaker of today's webinar. My name is Bahija GOUIMI. I'm the president and the founder of Amal organization based in Marrakesh, Morocco. And I'm doing activity for more advocacy activity in Morocco for more than 23 years. And I'm also representing Africa and Middle East in many organizations. Thank you.
Thank you, Bahija. Start with personal story of Bahija and a journey to access personalized medicine, which led to take an active role in her community in Morocco. So over to Bahija.
Thank you, Hussein. And very good opportunity to share my story. Today, I would like to share my journey through this journey map. Actually, in 2002, I was diagnosed with CML, chronic myeloid leukemia, a type of blood cancer. And it was during pregnancy, a deeply overwhelming experience. And I was terrified not only by the cancer diagnosis itself, but also by the possibility of losing my baby. And I still remember the words of the doctor saying, you have only 3 years to live. And at that time, in 2002, there were no treatment, patient organizations or support available. And my family and I suffered from care centralization. In the same time, I had to juggle, working and taking care of my three kids, children, and also traveling more than 1,400 kilometers over 4 days every month to receive life-saving treatments. And in the same time, in clinics, I faced inequities. Most patients were illiterate without health insurance, no access to treatment or clinical trials. And so I started engaging with patients, caregivers, physicians, and also attending trainings, meetings, and congresses just to gain knowledge and to understand, but also to build a network. And all these experiences inspired me to dedicate my life to founding Amal organization. And in 2022, we built and inaugurated Dar al Amal facility. It's a patient facility providing dignity and support to cancer patients and their families who travel very far from village and far cities from home for treatment. And this is how I turned all my pain into purpose, and I transformed my personal struggle into a collective mission for change. Next slide, please. You can see in this slide, over time, patients have evolved from a disease, a passive recipient, a client, a consumer, a healthcare user, a digital patient, an expert, an advocate, to an empowered part of patient groups, patients organizations, and also network or alliance. And this reflects exactly, progress in patient-centered care, shared decision-making, and co-creation of solutions, but also holistic approach and a digital revolution. I think advocacy is essential because nothing for us without us. I learned to never underestimate, myself, my voice, and my story, because we can move mountains and inspire and empower others people. And I still remember when I finally got the first box of targeted treatment that I brought from Spain. I was very proud to show it to my physician, thinking, look, I am a hero for bringing this medication for the first time to Morocco. But when I saw other patients in the waiting room, in the same room, without any treatment, I felt guilty, and I hid my medication box. And looking back, I think that moment was the first act of advocacy. Next slide, please. And now, let me share with you some key lessons I have learned. The first one, we can't advocate for others if we are not well. Taking care of our health and emotions come first, and also coping mechanism and sincerity and authenticity are vital. And the second lesson is that advocacy is not complicated and doesn't require perfection, doesn't require to be really 100%. I remember I started advocacy without knowing it was advocacy, and we don't need to be at the top or to begin. We start small, take simple actions, and build from there. You will gain experience and so on. And the third lesson is for sure that advocacy is a journey of continuous learning and growth, gaining experience through actions and learning by doing. Every day you have to learn something new. And I never imagined, for example, that one day I will meet the Minister of Health to advocate for patients and to secure the first line targeted therapy and pushing for the reimbursement of the second line therapy in Morocco. It was a success story, and I'm very proud that our patients in Morocco now had the two line therapy. I'm sure that we have, a critical role to improve access to precision medicine, especially in low and middle income countries, because precision medicine is not, it's not a luxury. We deserve to be treated with dignity and also to have, the right treatment in the right time for the right patient. Another key learning is to seize opportunity as they come and to build strong relationships and partnerships, and also recognize the shared responsibility to speak up. And I think that I believe, and I'm sure for that, and everyone will share that with me, that every advocacy skill we develop starts with us, because we can change the world, we can change people unless we are willing to change ourselves. And advocacy also is, for me, is universal, because we are all advocates for a better life within our families every day. So we all have a role to play, and we are all responsible in this field. And we need also to advocate. We need to advocate for access. We need to advocate for dignity, for hope, but also we need to advocate with love. Next slide, please. Now I will talk about challenges, and despite progress, we continue to face challenges, such as, for example, a resource limitation. You know that advocacy requires money, people, and tools to run effectively. And if funding is low, it becomes very difficult to expand, for example, campaigns, provide services, or reach target audiences. The second challenge is resistance, and this is the big challenge, because advocacy work can face resistance from people, sometimes for patients themselves, sometimes, and this is the majority is the systems, because they want to see the change due to the cultural norms or political will. And the next challenge is the awareness gaps. And in a low and middle income country, we are suffering from, language barriers, and advocacy requires clear communication. But sometimes misinformation or language barrier can make it hard for the public to understand the issue, or, for example, to take action. And the next challenge is fragmentation, because advocacy groups working, separately, independently, or with conflicting goals can create fragmentation. And this challenge can reduce, the effectiveness of their efforts, and waste valuable resource when we are, doing advocacy activities. Communication sometimes it's very difficult to gain the media attention, or to control misinformation. Another one is the legal constructs. In some region, government impose censorship or legal restriction that limits advocacy efforts. In some countries, especially in Africa and Middle East, it's forbidden to create a patient group or an organization, in civil society. Advocacy outcomes aren't always easy to quantify. This is what I am talking about, how to measure impact, especially for long term, like, for example, changing public attitude or influencing policies. And the other challenge is burnout, because we are all working as a volunteer. Advocates, many of whom are volunteers, and they can experience emotional burnout from dealing, with heavy workload and slow progress, and also emotionally charged issues. And sometimes we have another challenge is the external crisis. Sometimes the global event, like, for example, economic crisis, pandemics like we experienced it with COVID-19, or wars, can pull attention and funding away from advocacy causes. And it could slow, the progress regarding advocacy. I will stop there. Thank you for your attention, and for sure, I will be happy to answer your question. Thank you.
Thank you, Bahija.
This question I wanted to hand over to you, Bahija. Since you had talked about the need to advocate for access and of course you had shared your personal journey, but I'm wondering what advice you would give to someone who might be finding themselves in a similar situation. I imagine a lot of the people joining here today are perhaps just getting to know about personalized medicine or precision medicine, but perhaps among those who are interested in kind of going the extra mile and thinking about advocacy, what advice you would share with them, perhaps what have been the biggest challenges or learnings or opportunities that you have learned along the way.
Thank you, Helena. Actually, I don't have one advice, but three advices. But the most important things, advocacy is to start with passion and knowledge, but also persistence, because advocacy is a long journey, but only with the right approach. My first advice is to start by educating yourself and others, because education is the key. To advocate effectively, we must first understand the science and the barriers and the impact on patient, and to show what is precision medicine and what are the benefits on patients, and also learn from experts. Try to have the right information from experts, attend conferences, and stay also updated on policies in each sitting and in the proper sitting. But also try, because when we are hearing precision medicine, something people, they can think this is something simple. Try to simplify the message, because many patients and policymakers may not fully understand the precision medicine and what is the point after having the precision medicine and the targeted treatment. And the second advice is for sure to identify the main barriers to access, because in many countries precision medicine is still limited by cost, infrastructure, and awareness, as said by Ramsey. And try to identify the specific challenges in our region, in each region, and to ask this question, like, there is a lack, for example, of trained professional? Are targeted therapy covered or not by the insurance? Are diagnosis tool, like for example genetic testing and biomarkers, available or unavailable in my countries? And once you pinpoint these barriers, you can tailor your advocacy efforts to address them. And the third one is, for me, a must is to build strong alliances, because advocacy is more powerful when it's done collectively. We have to don't waste resources, but also to work effectively and form partnerships with patients, with caregivers, with doctor researchers and policymakers, and also the health authority, and try to understand what is doable to improve patient precision medicine in each setting.
Thank you so much, Bahija. And I know in the From Testing to Targeted Treatments program, we're often talking about ideas to overcome these kinds of access challenges. And we recognize that indeed, as you said, the context can be very specific in a given country. So understanding the specific situation, the specific context is important. At the same time, there are certain kinds of things that tend to be a trend. So typically, for example, we hear that the importance of the patient understanding what it is and being able to have informed discussions with the healthcare providers, making sure that there is access to the test, the biomarker test, for example. So I think those are really important points. And Bahija, over to you. Any last comments that you would like to share?
Yes, thank you very much. In conclusion, I will end where I began. Advocacy is simple, and just be authentic, be yourself, and always be willing to learn from others. And it's something very important in our region. We start as a patient now. We are doing a lot for our communities, and our voices matter, and every life matters. And together we can create a world where cancer patients are not just victims or survivors, but thrivers enjoying a good quality of life. And sometimes we are looking from miracles, forgetting that we ourselves are the miracles. Thank you very much.
Thank you, Bahija. And final word from you, Marius, before I hand back over to Hussein.
Yes, so my my final message is actually linked with the question coming from Shani in the Q&A chat. So personalized medicine, of course, is not such a new concept, but hopefully should become a mindset for all the people working in the health domain. And I'm sure that as well for lupus and other diseases, not only for cancer, when applying the personalized medicine, we'll be able to have better results in terms of efficacy and safety. And it's a great moment of opportunity with all the omics sciences, with artificial intelligence and digital twins, all contributing to change the traditional narrative when it comes to health and diseases.
If you allow me,
so much.
if you allow me to add something, it's time also to recognize the patient expertise, because it's sometimes we have to recognize the patient. It can save money, it can make a change and improve the care conditions in our region and in all, across the world. Thank you.
Thank you, Bahija.